Before we start, please, subscribe to my channel and click the bell icon. What is vitamin B12, and why do you need it? Vitamin B12 works together with folate in the synthesis of DNA in red blood cells. It's also involved in the production of the myelin sheath around the nerves and the conduction of nerve impulses. You can think of the brain and the nervous system as a big tangle of wires. Myelin is the insulation that protects those wires and helps them to conduct messages. Severe B12 deficiency in conditions like pernicious anemia, an autoimmune condition where the body destroys intrinsic factor, a protein necessary for the absorption of the vitamin, used to be fatal until scientists figured out death could be prevented by feeding patients raw liver, which contains high amounts of B12. But anemia is the final stage of a deficiency. Long before anemia sets in, deficient patients will experience several other problems, including fatigue, lethargy, weakness, memory loss, and neurological and psychiatric problems. The stages of a deficiency. B12 deficiency occurs in 4 stages, beginning with declining blood levels of the vitamin, stage 1, progressing to low cellular concentrations of the vitamin, stage 2, an increased blood level of homocysteine, and a decreased rate of DNA synthesis, stage 3, and finally, macrocytic anemia, stage 4. Common B12 deficiency symptoms. 1. Tingling hands or feet. Vitamin B12 deficiency may cause pins and needles in the hands or feet. This symptom occurs because the vitamin plays a crucial role in the nervous system, and its absence can cause people to develop nerve conduction problems or nerve damage. In the nervous system, vitamin B12 helps produce a substance called myelin. Myelin is a protective coating that shields the nerves and helps them transmit sensations. People who are vitamin B12 deficient may not produce enough myelin to coat their nerves. Without this coating, nerves can become damaged. Problems are more common in the nerves in the hands and feet, which are called peripheral nerves. Peripheral nerve damage may lead to tingling in these parts of the body. 2. Trouble walking. Over time, peripheral nerve damage resulting from vitamin B12 deficiency can lead to movement problems. Numbness in the feet and limbs may make it hard for a person to walk without support. They may also experience muscle weakness and diminished reflexes. 3. Pale skin. Pale or yellow skin, called jaundice, may be a symptom of vitamin B12 deficiency. Jaundice develops when a person's body is not able to produce enough red blood cells. Red blood cells circulating under the skin provide it with its normal color. Without enough of these cells, the skin may look pale. Vitamin B12 plays a role in the production of red blood cells. A vitamin B12 deficiency can cause a lack of red blood cells, or megaloblastic anemia, which has an association with jaundice. This type of anemia can also weaken the red blood cells, which the body then breaks down more quickly. When the liver breaks down red blood cells, it releases bilirubin. Bilirubin is a brownish substance that gives the skin the yellowish tone that is characteristic of jaundice. 4. Fatigue. Megaloblastic anemia due to vitamin B12 deficiency may lead to a person feeling fatigued. Without enough red blood cells to carry oxygen around their body, a person can feel extremely tired. 5. Fast heart rate. A fast heart rate may be a symptom of vitamin B12 deficiency. The heart may start to beat faster to make up for the reduced number of red blood cells in the body. Anemia puts pressure on the heart to push a higher volume of blood around the body and to do it more quickly. This response is the body's way of trying to ensure that enough oxygen circulates through all of the body's systems and reaches all the organs. 6. Shortness of breath. Anemia that results from vitamin B12 deficiency may cause a person to feel a little short of breath. It is possible to link this to a lack of red blood cells and a fast heartbeat. Anyone who is experiencing real difficulty breathing should see a doctor straight away. 7. Mouth pain. Vitamin B12 affects oral health. As a result, being deficient in vitamin B12 may cause the following mouth problems. Glossitis, which causes a swollen, smooth, red tongue. Mouth ulcers. A burning sensation in the mouth. These symptoms occur because vitamin B12 deficiency causes a reduction in red blood cell production, which results in less oxygen reaching the tongue. 8. Problems thinking or reasoning. Vitamin B12 deficiency may cause problems with thinking, which doctors refer to as cognitive impairment. These issues include difficulty thinking or reasoning and memory loss. One study even linked low vitamin B12 levels to an increased risk of Alzheimer's disease, vascular dementia, and Parkinson's disease. The reduced amount of oxygen reaching the brain might be to blame for the thinking and reasoning problems. 9. Irritability. Being deficient in vitamin B12 can affect a person's mood, potentially causing irritability or depression. There is a need for more research into the link between vitamin B12 and mental health. One theory is that vitamin B12 helps break down a brain chemical called homocysteine. Having too much homocysteine in the brain may cause mental health problems. 10. Nausea, vomiting, and diarrhea. Vitamin B12 deficiency can affect the digestive tract. A lack of red blood cells means that not enough oxygen reaches the gut. Insufficient oxygen here may lead to a person both feeling and being sick. It may also cause diarrhea. What to do if you're experiencing vitamin B12 deficiency symptoms? If you suspect you have a deficiency, the first step is to get tested. You need an accurate baseline to work from. If you are B12 deficient, the next step is to identify the mechanism causing the deficiency. You'll probably need help from a medical practitioner for this part. Once the mechanism is identified, the appropriate form, injection, oral, sublingual, or nasal, of supplementation, the dose, and the length of treatment can be selected. So, next time you or someone you know is having a senior moment, remember, it might not be just aging. It could be B12 deficiency. Thanks for watching. Please share this video and subscribe to my channel. Thanks.